Medical experts are urging African parents, particularly in Nigeria, to ensure their children receive routine vaccinations from healthcare providers, especially at primary healthcare centers. The medical professionals who said the vaccines are crucial for child safety stressed the importance of visiting primary healthcare facilities to inquire about the appropriate vaccines for individuals of all ages. The report.
The African Vaccination Week highlights the significance of vaccination in addressing public health challenges, especially in Africa, which bears over 75% of the global infectious disease burden. A major obstacle in Africa has been vaccine hesitancy and suboptimal vaccine uptake. While it is well established that many infectious diseases are vaccine preventable, however, vaccine uptake remains in challenge. At the College of Medicine, Idi Araba, we spoke with the head of infectious diseases, Dr. Ihohen Akase, on the impact of zero vaccination on children. He and others shared his perspective on the necessity of vaccination for Africa, particularly Nigeria.
Most of the infections are vaccine preventable. And infections, for children, they enter into a loop where they predispose them to delayed milestones. Repeated infections predispose them to delayed milestones, including things like malaria, where they are not able to feed well, and when they don't feed well, they don't grow well. And occasionally they may even become malnourished, as the case may be, and which they enter into a cycle of infection causing malnutrition leading to more infections, and it becomes a cycle that keeps going, over and over again.
Vaccination basically brings about immunity to children when they are giving birth to. So when you have a baby, it's important that you vaccinate that child against so many infections or diseases such as polio, hepatitis, so many other organisms of medical importance. So what vaccination basically does is that it converts immunity into a child, so that child doesn't come down with any of those diseases or infection.
Beyond just making sure that your children are up to date with their vaccines, there's a vaccine schedule. Please go to a primary healthcare center or a healthcare facility near you to find out what the schedule is and if your child is on course, and if not, try to get the required vaccines. But beyond children, everybody has a vaccine that they need and that they can take. For instance, young girls from the age of 8 to 13 or 14 can take HPV vaccine, which protects against cervical cancer.
Improving vaccine uptake is not just a matter of health policy, it is a critical public health imperative for Africa's present and future well-being.